Hello and welcome to the COMLEX Instant Review. Let's talk about impetigo. Now with impetigo, diagnosis is mainly based on a clinical appearance of honey-like exudative rash, but the treatment is with an oral cephalosporin. And that's important because you may see lots of medications, but the correct answer here is oral cephalosporins, and in occasional cases, bacitracin or mupirocin can be used. So patients presenting with the honey-like crusted lesions are going to be considered to have impetigo, and it's a superficial vesiculopustular infection. Um, the key association it has is with post-streptococcal glomerulonephritis. That's the key association that you want to remember for the board exam. Um, Also understand that group A streptococci and Staph aureus cause the disease. So, oral cephalosporin, such as cephalaxin, honey-crusted-like lesions, association with post-streptococcal glomerulonephritis is going to be impetigo. Another high-yield skin condition in infectious diseases, erysipelas. Erysipelas will present with a shiny red edematous rash. So it's different from the previous disorder, impetigo. Now, based on clinical presentation, you can most likely make the diagnosis, and patients here will have marked swelling, superficial epidermidis, and the treatment will be with oral penicillin or a first-generation cephalosporin such as cephalaxin. If you look at erysipelas, you'll see the shiny red edematous rash, sometimes over the face or on the legs near the heels and the calf muscles. Now let's talk about dermatophytes. Well, we could start with tinea. Okay, tinea is going to be grouped into several different classes based on the location of the body that it affects. So, tinea corporis is for the body, tinea capitis is a ringworm for the head, tinea cruris is going to be jock itch in the groin, and tinea pedis is athlete's foot. Keep in mind that the diagnosis is made by visualizing fungal elements on a KOH smear of skin scraping. Okay, that's the key here. Also, the treatment is with topical antifungal medications such as miconazole, and the medications for tinea capitis and unguinium may need an oral antifungal treatment. What causes this is mainly Microsporum, Trichophyton, and Epidermophyton species. Now let's talk about tinea versicolor. Classic presentation is going to be patient who have different shades of colors like white, tan, or brown in the upper trunk and extremities, and they complain of pruritus. You can make the diagnosis by direct microscope examination with a 10% KOH prep, and you'll see spaghetti and meatball pattern with hyphae. It's caused by Pityrossum species, okay, and the treatment is with topical antifungals such as ketoconazole. So if you look at the classic pattern for tinea versicolor, you will see that there are different shades of white, tan, or brown in the chest region, and it's caused by Pityrosporum orbiculare, and the treatment again is ketoconazole. Now, let's talk about herpes zoster. Well, with herpes zoster, remember that if it crosses the midline, it's not zoster, okay? The other fact is that it's a burning, like electrical shock-like feeling, and with a classic dermatomal distribution. Immunocompromised patients can have a severe disseminated infection. Also, the VZV is a virus that causes chickenpox, and herpes zoster is caused by the reactivation of VZV. Zoster occurs when virus reactivates, and the reactivation is most common in elderly or immunocompromised patients. The diagnosis is mainly based on clinical presentation, and the treatment is with antiviral medications like acyclovir, and patients may also require pain medications like tricyclic antidepressants, and those have been useful for neuropathic pain of herpes zoster. Now, let's talk about The complications. Well, patients can develop prolonged pain period called post-herpetic neuralgia after a zoster flare. And if the tip of the nose is affected, then an ophthalmic evaluation becomes necessary. That was a quick COMLEX and USMLE board review of some of the high-yield skin infections such as impetigo, erysipelas, herpes zoster that you're likely to see on the COMLEX board exam. Please visit comlexflashcards.com for additional lectures on all of these topics, and good luck in your preparation for the board.